Hi, everyone. Thank you for joining us here today. My name is Tarin, and I am one of the knowledge and research leads here at the Center for Innovation in Campus Mental Health. I'm really excited for this webinar today, but before we begin, I do want to acknowledge that we are joining in from the ancestral lands of many Indigenous communities. I am currently in Toronto, Treaty 13 territory, and the home of the Anishinaabe, Haudenosaunee, Wendat peoples, the Mississaugas of the Credit, the Chippewa, and people who may still be unrecorded. As a settler myself, it is really my duty to acknowledge the effects of colonialism that we see today and the many ways that I may be participating in it and the many ways I can actively push back against it. So I hope while we are going through this webinar, as well as after you leave this webinar, you keep thinking about the ways that you can support your Indigenous students and colleagues within your role, and ways that you can be an active participant in the reconciliation process. So again, before we begin, I do want to go over some housekeeping. So there is closed captioning at the bottom of the screen that you can turn on. There is French closed captioning as well. If you'd like to turn that on, you just have to make sure you set the speaking language as English, and then you can select the closed captioning language as French, and that should pop them up. The chat function is available to discuss thoughts and reactions. The Q&A function is available to submit questions to the panelists. We will do that in the last 15 minutes. So if you have any questions, we will go through them then. And the recording will be available on our website after the webinar. Usually I upload it at the end of the day or the next day, so keep a lookout on that. And we also do have a post-webinar survey, so please keep an eye out on that. We love to hear your thoughts about this webinar as well as what you would like to see next. So without further ado, I will turn it over to our speakers. We have Émilie Gaudet as well as Beáta Bőthe from Montreal University, and they will be speaking on the topic of understanding problematic pornography use. So I will stop sharing my screen and I will turn it over to you.
Well, hi everyone. I'm really happy to be here today to talk to you about problematic pornography use among post-secondary students. So my name is Émilie Gaudet, and I'm a PhD student working under the supervision of Dr. Bőthe. And my research focuses on problematic pornography use as well as compulsive sexual behavior disorder. So today we'll be diving into several key topics related to pornography use, especially what happens when it becomes problematic and how we can assess it effectively. We'll be focusing on students, and so I'll start by exploring who might be at risk of developing problematic pornography use, or PPU, we call it, and why. And then Beáta will take over to talk to you about a specific assessment tool and prevention strategies, interventions. And yes, so we'll do our best to cover the questions you might have in mind. And of course, we'll be happy to take any further questions at the end of the presentation. So I'll start with the first question that comes to mind: who actually watches pornography? Well, as you may guess, pretty much everyone has viewed pornography at some point in their lives. So to give you a sense of the scale of this phenomenon, a few statistics from Pornhub, which is one of the most visited porn sites in the world. So in recent years, Pornhub recorded an average of 1.55 billion monthly visits worldwide. And Canada consistently ranks among the top 10 countries. So pornography use has become a highly prevalent sexual behavior in modern societies. If we look a bit more specifically at prevalence, roughly 70 to 95% of people have viewed pornography in their lifetime. I don't know if you have any guesses on how many students or university students watch pornography nowadays. I don't know if I can give the, anyone raises their hands, if we can.
Folks can use the chat if you'd like. We have someone say 90%.
9%. That's a good guess. It's
85.
actually 85. Yeah, you guys are very close. So it's actually, 70% of university students. So quite high. And in North America, studies among post-secondary students reveal notable gender differences. So about 80% of men report viewing pornographic videos, whereas 20-30% of women report similar behaviors. And interestingly, the numbers are quite high as well for Canadian sexual and gender minority youth. So about 52% report viewing pornography at least once a week. So that really speaks to like the scale of this phenomenon, which is quite widespread. This one, I'm sorry. It also shows like potentially distinct patterns of use among marginalized populations. I'll get back to that a bit later. So in today's digital world, online pornography is by far the most common way people access explicit content. So largely due to the widespread availability of high-speed internet and smartphone. So for example, according to a US study, close to 70% of students access pornography via cell phone, while 15% use a laptop and around 6% use the tablet. Furthermore, 70% of college students report engaging in privacy preserving behaviors, such as browsing in private mode or clearing their browser history, so to avoid leaving digital trace. So these numbers highlight how autonomy, portability, and discretion are central to how younger users engage with pornography today. So exposure to pornography, it usually starts pretty early, so typically in early adolescence. On average, the first exposure happens around 12 years old, but about 1/3 of these youth can be exposed as early as 10. If we focus on Canadian youth specifically, about 1/5 have experienced unintentional exposure to pornography. And these trends happen more often to women, while young men are more likely to seek it out on their own, so driven by personal curiosity. Another important question is, why do people watch pornography? While many people still see pornography as inherently oppressive, that's not always true. So people turn to porn for all sorts of reasons. Some that can be helpful, some that might lead to problems, and others that don't have much effect at all. So research has identified about 8 common pornography use motivations that are reported among participants of many studies. Do you have any guess on what these motivations could be? Look at the chat here. That's a great one. Yes. Pleasure, of course. Yes, absolutely. Boredom, yes. Curiosity, yes. Yes, curiosity, a lot of names. Get better, yes. Reduce stress. My God, you guys are emotional. Excellent. Here they are, and you've named most of them. So yes, sexual pleasure is one of the main one, but curiosity as well. So which means using pornography to learn new things or get ideas about specific sexual behaviors. Emotional distraction or suppression is also an important one. So stress reduction, self-exploration, which is a bit different from sexual curiosity. So it refers specifically to to better understand one's own sexual desires and preferences. So yeah, what's really important here isn't so much what kind of people, what kind of pornography someone uses, but it's really the why and the how behind it. That's what's important to. That's the takeaway here. So, oops, I'm sorry. I have a lot of slides to. Yeah. So if we take the example of sexual and gender minorities, so they tend to show specific patterns in their pornography use, and two motivations that are reported very often are sexual curiosity and education. So especially in the absence of inclusive sex education, as well as to cope with emotional distress. So motivations are shaped not only by personal reasons, but also as a way to manage the impact of social inequalities, lack of representation, marginalization, and limited access to sexual health resources. Pornography use motivations can also help differentiate between recreational and problematic pornography use. So non-problematic users will often cite reasons like, again, sexual curiosity and education and sexual exploration, while problematic users, in contrast, are more likely to report using pornography to suppress negative emotions, to manage stress, or to escape from difficult personal experiences. So now it's important to be clear, watching pornography isn't inherently pathological, but for a subset of individuals, their use can become a source of significant distress or impairment. And this is what we refer to as problematic pornography use, or PPU. While PPU is not a diagnosis on its own in the classification manuals, it's considered one of the most common ways that compulsive sexual behavior disorder, or CSBD, shows up in real life. So about 80% of people who meet the criteria for CSBD also report struggling with their PPU. If we look at the definition of CSBD in the International Classification of Disease, the definition can be applied to PPU. So PPU may be defined as a persistent, repetitive pattern of uncontrollable sexual urges and behaviors that are related to pornography, resulting in distress and impairment. So the key issue in these two sexual behaviors, so CSBD and PPU, is really a loss of control over sexual urges and behaviors, which leads to problems in daily life. And another important one is that individual will use pornography even when it brings little or no satisfaction. So these are two key aspects. If we take a look at the scientific studies, their numbers have, excuse me, I'll just have a drink of water. So the number of studies on CSBD, including PPU, has exponentially increased in the past 25 years. So resulting in more than 400 studies, empirical studies on this topic. And this might seem like a lot at first, but actually it's not that much. If we look at substance use disorder, for example, the number of studies on that topic, so just published in the last 2 years, excuse me, is way bigger than the ones on CSBs in the past 2 decades. But what's interesting is that most of the studies on CSBDs and PPU have been conducted among students. So we have a lot of data on that population. I have a little cold, so this explains the coughing. Give me 1 minute and I'll get back to the slides. Okay. So one of the most recent and comprehensive studies published to date is the International Sex Survey, which included over 82,000 participants from 42 countries and 5 continents. And so this study found that about 3.2% of people report experiencing PPU worldwide. And in Canada, we can see that the rates are similar. There are clear gender differences, and I have another question for you. How would you rank men, women, and gender diverse individuals in terms of the highest levels of PPU? You have any ideas who would come first? Man highest, yes. Man gen. Ooh, good one, Amelia. Well, you have the right one. That's exactly it. Yes, yes. You know a lot on this topic. Um, so, oops, excuse me. But I think yeah, so that's it. So men report the highest levels of PPU, followed by gender diverse individuals, and then women. Interestingly, this study showed that there were no differences based on sexual orientation. So, who is most at risk? Although Canadian data is limited, men students appear particularly vulnerable, so mirroring international trends. But risk isn't just about gender, there's several other factors. And I'll just name a few common ones. So early exposure to pornography, as we mentioned before, as well as childhood adversity. But on the flip side, some factors may actually serve as protective. So for example, having a strong personal motivation to reduce use, and in some case, faith or moral belief. So for example, higher levels of religiosity have been linked to a lower frequency of pornography use. So the takeaway here is that someone's background, personal context may help us understand their level of risk. How does PPU affect students specifically? Well, some common negative consequences that are reported are poor social functioning, decreased friendship quality, body image dissatisfaction, and monitoring, especially among gay men and women. Financial and academic problems due to prioritizing pornography, as well as physical symptoms and addictive behaviors such as binge drinking and drug use. So for some students, PPU doesn't affect just their private lives. It can really spill into their social, academic, or even physical well-being. What other issues or disorders tend to show up alongside PPU? Well, let's take a look at one study that really highlights the mental health impacts of PPU on students. So the study found that the students that reported PPU, especially women, had higher average levels of depression, anxiety, and stress compared to those who didn't. So this pattern of women experiencing greater mental health impacts has been replicated in multiple studies, so further highlighting the importance of considering gender when we're looking at PPU. And importantly, PPU significantly affected like all three mental health domains in both men and women. So it really speaks to its broad psychological impact. Another study focused on PPU and suicidal behavior. And in this study, PPU was not linked to having suicidal thoughts in the past 12 months, but it was significantly associated with students' own perception of their likelihood to engage in suicidal behavior in the future. So what does this mean in real terms? Well, even though students with PPU might not report having suicidal thoughts recently, they do feel more likely, they do feel more worried about the possibility of this kind of behavior, suicidal behavior in the future. So PPU could be linked to a sense of hopelessness or distress that may increase vulnerability over time. And it's a signal that we really need to pay close attention to mental health and coping strategies in students reporting PPU, especially, in these populations where stress and pressure can already be quite high. Another interesting thing to consider is that research reveals some really fascinating gender-specific patterns in how pornography use connects with sexual well-being. So if we start with men, men who frequently engage in sex within a relationship, they also tend to use pornography regularly. So this actually challenged the stereotype of the socially isolated or sexually deprived pornography user. Actually, for some men, high pornography use may reflect a broader sexual ethic or personality orientation, one that places strong value on sexuality in general. Furthermore, men who show a combination of high risk, of frequent relational sex, regular pornography use, and positive attitudes toward porn, they also tend to report the highest levels of substance use. So this suggests a broader pattern of sensation seeking or permissive attitudes toward risk-taking behaviors in general. Now, if we look at women, the patterns are quite different. So women who engage in high levels of sex within a relationship, they report the most positive mental health outcomes, such as higher self-worth and lower depression symptoms, while women with high use and high acceptance of pornography, but less relational sexual behavior, tend to report the lower self-worth and higher depressive symptoms. So basically, for some women, feeling depressed might make them less interested in sex with a partner, and instead they might turn to porn as a way to stay connected to their sexuality. But unlike relational sex, which seems to support mood and self-esteem, porn use on its own may not offer the same emotional benefits. So to sum up, what's important to consider is that the PPU is a complex issue. It's influenced by multiple factors, so gender, context, attitudes, motivations, mental health. And it's important to be cautious when we're linking pornography directly to negative outcomes. So with that in mind, I'll now pass things over to Beáta, and she will walk us through how to assess and intervene effectively when working with individual experiencing PPU. Thank you.
Thank you, Émilie. Good morning. I'm happy to be here. While I'm sharing my screen with you and we start to talk about problematic pornography use, assessment, and intervention, I'm going to introduce myself as well. I'm an assistant professor at the University of Montréal, and I've been doing research on PPU and other problematic and compulsive sexual behaviors for more than 10 years now. So I have a little bit of experience with this topic. Now what I want to do is to give you an overview on what we know, how we usually assess the risk of PPU, and I included a lot of information on these slides because we're going to share the slides with you. So you can use these slides whenever you want, and you can come back, read the papers, read the questions we share. And if you need any more information, don't hesitate to reach out to us after the presentation as well. So let's start with the big question. How much porn is too much porn? Can we say that if people watch porn, for example, 2 times a week, it's problematic? What do you think? Is it enough to ask a question like what we do, for example, in the case of other problematic behaviors, asking questions about the frequency of use, the quantity of use? Can we say that if someone watches porn frequently, this is what problematic pornography use is? You can say yes or no in the chat, and then I see what you think. Okay. No, great. That's what I wanted to see. Yes, that's true. Because when we talk about porn use, there are several factors that can affect whether we talk about problematic pornography use or not. And this also begs the question whether high-frequency porn use is always problematic, and whether we can see people who feel that they have issues with their porn use, even when they watch porn, for example, once a year or once a month. So we're gonna address these 2 questions first. After that, I'm gonna show you some scales that you can use as screening tools to identify people who might have an issue with porn use, and then I'm gonna walk you through the diagnostic process and potential interventions for problematic pornography use. So let's start with the question, how many people watch porn frequently without problematic pornography use? We conducted a really big study back in 2020, and it seems what's really interesting here is that we have around Can you see my mouse? Yeah, perfect. I wasn't sure. So what we can see here in green is that approximately 70% of people watch porn with a low frequency, for example, once a month. They don't report any problems with it. We have around 3 to 8% of people who watch porn with a high frequency, and they are problematic users. They report behavioral dysregulation, negative consequences and impacts. But what's even more interesting is that we have around 20 to 30% of people who watch porn with almost exactly the same frequency several times a week or even daily or more than once a day, and they don't report any issues with their porn use. So it seems that different mechanisms may explain why some people watch porn frequently without developing problematic pornography use, and why some people may develop problems with their porn use when they watch porn quite frequently. So the takeaway from here is that, yes, we can ask questions about the frequency of porn use, but it's not enough to diagnose someone with PPU simply based on the frequency of porn use, because, for example, single individuals might watch porn more frequently because they don't have a sexual partner and they have high sexual desire. So that wouldn't be diagnosed as problematic pornography use. The next question that I asked you is whether some people can develop problems or self-perceived problems with their porn use when they watch porn with a low frequency. Around 6 years ago, a theoretical model was developed to address this question. I'm going to walk you through this model really quickly, but if you're interested, you can read the paper. This model says that some people report problems with their porn use because they develop behavioral dysregulation, so they cannot really control how much porn they watch, what they watch, and this results in significant distress and negative consequences, like Émilie mentioned. However, we have another group of people who report problems with their porn use or seek treatment, and these people are the people who have moral issues with their porn use. So, for example, some people may think that I have strong values that say that I cannot or shouldn't watch porn, but I still watch it. And when this happens, there's a clash between one's behaviors and one's values. And this clash can lead to moral incongruence between the behavior and the values, and people might feel that they have problems with their porn use because of these moral issues. And of course, several studies were conducted checking whether this is actually true, because this is a theoretical model. We need to test it in research settings, and it actually seems that yes, some people may develop self-perceived problems with their porn use due to moral issues. So this is really important for us for two reasons. First of all, when we take a look at the official diagnostic criteria for CSBD, which includes problematic pornography use, we have an exclusion criterion saying that when people experience problems with their sexual behaviors or PPU, porn use, and they experience these problems only due to moral judgment or disapproval, we shouldn't diagnose those people with PPU or CSBD. They still need help, but this is not CSBD. This is not compulsive sexual behavior disorder. So this is really important. And why is it important? Because based on different studies with younger men and teenagers, we can see that approximately 1/5 or 1/4 of people who seek help for their porn use do not report any control issues, negative consequences, behavioral dysregulation, nothing like that. They only have moral issues with porn use, and they still seek help. So it's really important to differentiate between these groups of people. And here, this is one of the slides that you can check out on your own if you're interested in question, because there's a treatment algorithm and diagnostic algorithm that can help you differentiate between those people who have behavioral dysregulation issues, those people who experience issues with their moral values and behaviors and report problems with their porn use. And of course, we have some people who might actually have behavioral dysregulation issues and they morally disapprove of pornography. So we can see those kind of cases as well. So if you're interested, please check out this really great article on this diagnostic process and treatment options. So I told you we cannot simply ask the question whether people watch a lot of porn, and then we cannot use that response to diagnose someone with PPU. So what can we do? We can use scales and screening tools to assess whether someone might have issues with their porn use. This is the first step, or can be the first step in a diagnostic process. And we have many scales in the literature, more than 25 scales in the literature, but the two best scales are the PPCS, Problematic Pornography Consumption Scale, and the Brief Pornography Screen. And I say these are the best scales because these scales have been validated across 42 countries. They are available in 26 or even more languages. And we checked whether these scales work properly among different groups, because we know that, for example, men and women and gender diverse individuals show different patterns of porn use. They watch porn for different reasons. This is the same for different sexual orientations. So we checked, and these scales work properly across all these different groups. And what's even better is that we have a cutoff score. So if people score above a score, I'm going to show you the score, then we can say that these people might be at risk of having PPU. So we can start to work with them and start the diagnostic process. Here I included all the items for the PPCS, the short, and the long version as well. And you can see that we usually give a definition of porn before asking about porn use. This is simply to make sure that we're talking about the same sexual behavior with our clients. So here you can see that if people score 76 points or higher, they might be at risk of developing or having PPU. And with the shorter version of the scale, it's 20 points. If you need this scale, just let me know. I have it in 26 different languages. And finally, regarding scales and the diagnostic process, we need to consider not only moral incongruence and moral values, but other factors that may impact the diagnostic process. So, for example, what we need to consider is the gender identity or sexual orientation of clients, because unfortunately, sometimes LGBTQ+ clients are misdiagnosed with CSBD and PPU, mostly due to minority stress-related issues like distress, because some LGBTQ+ clients may say that they are really distressed about their sexual behaviors. Sometimes they feel that they cannot control their sexual behaviors. For example, they want to stop their sexual behaviors. And this is important because if some LGBTQ clients have issues with their sexual behaviors due to minority stress, again, they shouldn't be diagnosed with CSBD or PPU. That's another problem or another issue for them. We need to deal with it, but it's not PPU or CSBD. So if you're interested in this topic, I recommend this article here, and this is a really nice way to check whether CSBD, PPU, or minority stress is the cause of the distress people might experience due to their sexual behaviors and porn use. So let's continue with the diagnostic process. Let's say one client scored above the cutoff score on the PPCS scale. What can we do? Well, it depends. That's going to be my response to all the questions after this, because it really depends on the client. We need to come up with an individualized intervention or treatment plan. Here again, I included some great papers on what we can do if we want to work with the sexual medicine perspective, if we work with a client who belongs to the LGBTQ+ community, or what can we do if we want to focus on comorbidities, for example, psychiatric comorbidities in the treatment plan. So here's a really great figure with different questions that we need to consider. For example, we can start with a long questionnaire or many questions on sexual history, psychiatric history, and we can, if needed, test or screen for STIs Of course, if someone only watches porn, it might not be necessary to screen for STIs, but if someone watches porn and engages in different sexual behaviors with casual partners, it might be necessary to do some STI screens as well. Then we need to decide whether the problem we see is due to CSBD or PPU, whether there are some comorbid disorders we need to consider, for example, substance use, because some people who experience problems with their pornography use also report substance use disorders, depression, anxiety, as Émilie said. And then we need to come up with an individual case formulation. So here you can see that we need to consider a lot of factors when we come up with this individualized case conceptualization. We need to consider individual factors, for example, why that person watches porn in a problematic manner, why they want to seek treatment. Is it because they feel they have a problem with it, or is it because of their partner? And we also need to consider different socio-cultural factors like minority stress, especially in the case of minority populations. And based on all these questions and all this information, we come up with the best treatment for our client. And on the next slide, I included many questions and many topics you can cover based on your client. So for example, if you have a client who had sexual abuse or any other traumas in their past, you might ask about that too, because it can be important during treatment. If some people experience disturbing sexual fantasies relating to paraphilic sexual behaviors, it would be important to ask questions about those too. For other people, it might be important to ask about their motivation for treatment, because they are not the ones who wanted to be at treatment. They were just sent to you because their family, partner, or friends said that you might have an issue with your porn use, maybe you should talk with someone. So these are the questions we need to ask. And of course, we have some additional questions that might be important to ask. For example, what's really important is what is the function of CSBD or PPU in the client's life? Is this the way they try to cope with stress or negative emotions, or why they use porn? This is why Émilie talked a lot about motivations underlying porn use. And finally, based on the aims and based on the responses to those questions, we can come up with the aim or aims of treatment and choose the most appropriate treatment for our client. So for example, if we see that the person engaged in chemsex, so using different psychoactive substances to enhance their sexual behaviors, we might need to consider substance use and related factors as well during treatment. Okay, so what can we do? What kind of interventions we have for PPU? What do you think? What kind of interventions can we do? I'm going to wait a couple of moments. Yes, let's see. CBT, great, great. Other guesses? IFS, I'm going to wait for another one. Harm reduction, yes, exactly. Harm reduction education. These are amazing responses. And it depends on the client. Yes, exactly. So, okay, my slides. Okay, now it works. So what can we do? I'm going to start with some notes here because I'm a researcher. I've been doing a lot of research, and many colleagues in the field have been doing a lot of research on different treatment options for CSBD and PPU, because we want to use science-based interventions and treatment options for clients. And it seems that unfortunately, we don't have enough studies to say that, okay, this is the best treatment for everyone with PPU or CSBD, or we don't have enough information, for example, different treatment options for women or sexual minority individuals or gender diverse individuals, because most studies in the past focused on men with PPU. So just keep in mind that what I'm going to say is true right now based on some studies, but it might change in the future based on other high-quality studies like randomized controlled trials. So let's start with psychotherapy and the options we have. So based on different studies, again, I included a lot of information. You can read all these slides and all the papers I cited here. But what we can see is that if we consider all the different psychotherapeutic approaches, classical and new wave CBT, cognitive behavioral therapy, and its components can work really well to reduce symptoms of PPU in the long term as well. For example, after 6 months or 1 year. And these treatments or these types of interventions can help with reducing other symptoms as well, like stress, depression, or can improve even the quality of life of individuals. And some other approaches like 12-step programs or art therapy might also work, but again, we only had 1 or 2 studies on these approaches. So what I say, CSBD could work, but again, we don't know, for example, whether we should recommend full abstinence or controlled use of pornography use because we didn't have any studies on that. Then, of course, we can have medical treatment. I'm not a medical doctor, but based on studies, what we can see is that usually when psychotherapy and psychopharmacological therapy are combined, that works the best. Again, there are not many studies on this topic, but among men, again, just among men who report CSBD, paroxetine and naltrexone can work quite well to reduce symptoms of CSBD and PPU. Here I listed some treatment recommendations based on different pharmacological agents, and what I want to highlight here is that pharmacological treatment is usually not the first option when someone asks or seeks help for CSBD or PPU. We usually use these treatments when there's a comorbid disorder, for example, severe depression, anxiety, OCD, or other addictive disorders. So here you can see that the pharmacological choice is based on different comorbid disorders. Again, if someone reports, for example, paraphilic disorders, we can use different pharmacological agents to help them cope with these issues. And again, here's a big table with different treatment recommendations. And finally, I'm going to finish with this one, online interventions. Why do we need to talk about online interventions? Well, we need to talk about online interventions, first of all, because among people who are at risk of having PPU, only 5 to 10% of them have ever sought treatment for PPU. So only a handful of people seek treatment for PPU when they feel they have a problem with it. And they didn't do so because they couldn't afford it, they didn't know where to seek help, or they would have felt embarrassed because of their porn use. So it's really important to raise awareness about PPU without stigmatizing different sexual behaviors, creating a moral panic, and we need to provide better access to PPU treatment. So for example, we developed an online CBT-based online intervention for PPU, which is freely available for everyone. And we are in the process of testing its feasibility and efficacy as well. Here are the modules. You can recommend this to your clients if you want to. You don't need to, but if you want to, of course, you can do that. As I told you, it's free. And it seems to be working. So this is good news. People who participated in the online intervention reported lower levels of PPU symptoms, self-perceived addiction to pornography, and they reported better well-being in general. And let's finish with some resources in Ontario. This is a list of some of the options people might have who feel that they have problems with their porn use or they experience CSBD. And yes, to conclude, We might have around 5% of the population who have issues with their porn use, but not everyone who watches porn has PPU or CSBD. There are specific risk and protective factors, especially among university students, but those people who feel or experience problems with their porn use might experience quite severe negative consequences and impacts, like interpersonal issues with their friends, family, in their romantic relationships. They can struggle with keeping up with school or work, and they actually need help and treatment. And if you're interested in more research, here I listed some colleagues who do research among university students or the general population in relation to porn use and problematic pornography use. So thank you for your attention. I think we have 10-15 minutes for questions right now.
Yes, we do. Thank you so much. This is very, very insightful. I learned a lot, and I know that a lot of folks here might have learned quite a lot as well. I did notice a few questions in the chat, so I'm just gonna ask those. But if folks have questions, please put it in the Q&A function so we can get to those shortly. So there's a question here on the chat that's asking, are the impacts on the person for the two high-frequency user groups similar, but the awareness or interpretation of the use different?
Great question. It seems that actually the impacts are different. It's not just about being aware that some people have some problems with it, or I'm not aware that I have a PPU, because we checked approximately 30, 40 different variables, including sexual impacts, interpersonal impacts, intrapersonal impacts as well, mental health, and it seemed that people who were in the high frequency, non-problematic group reported better well-being, better sexual satisfaction, better relationship satisfaction, basic psychological needs satisfaction. So it didn't seem, at least to us, that these people had a PPU. They were just not aware of this problem. But this is a great question. Thank you.
We had an earlier question when we were talking about stats on Pornhub visits. So whether the previous stats on Pornhub visits were based on total visits or proportion of the population. So does that mean that, does the youth just have a larger population and that's why they have a larger amount of folks accessing Pornhub?
Actually, it was based on total visits, so they really look at like visits from many countries, and that's how they rank it. It's like you can look up on their not on Pornhub, but if you type Pornhub statistic 2024, you'll find all kinds of data on countries, type of pornography use, gender differences. But these stats are really it's a total visit to the site.
Okay, wonderful. We have more questions here. So, do we know what the protective factors may be for those that have high frequency use without developing PPU?
Yes, that's a great question again. For example, being satisfied with their life in general can be a protective factor. Having effective coping strategies when facing, for example, stress or negative emotions, setbacks, that could also work. Other factors I might mention is that loneliness is a risk factor for developing PPU. So having a community can help as well.
Okay.
But unfortunately, as with all problematic behaviors, we usually focus on risk factors and not protective factors. Yeah.
Sure. I have a couple of similar-ish questions here, but so one question is there an age range for which the screens are recommended? What about porn use in minors? Can the scales be used with younger ages too?
Actually, we validated the PPCS, the short version, among teenagers in Canada. So from the age of 14, that adolescent version can be used.
Okay.
And there's no upper limit.
Wonderful. And then are the rates in teenagers worse than in adults? Same as seen with gambling, which suggests a bigger problem coming down the line, especially considering that PPU has exploded due to online access.
Yeah, another wonderful question. So we have a big study in Canada, in Quebec, with 3,000 teenagers. They started to complete different sexuality-related measures when they were 14. Now they are 20. And when they were around 14 or 15, it seemed that approximately 8 to 10% of teenagers who watch porn might have issues with their porn use in terms of being or having PPU. So yes, it seems that it might be higher among younger people. In general, what we can see is that PPU, as people age, their levels of PPU reduces over time or decreases over time. So yes.
Okay. Another question. Do you think we should focus more on ethical porn to reduce moral incongruity?
Emily, do you want to respond or should I go? Okay. That's an interesting question. And I guess first we should see why people have issues with porn in terms of moral incongruence, because we know that some people have issues with porn because they come from a religious background and watching porn in itself is a problem. So that's one thing. I guess watching ethical porn wouldn't solve this issue, but some other people might say that porn use is not in line with my values because I think it exploits actresses or actors, it includes violence, and so on. In that case, for sure, ethical porn would be a great option. So again, we need to talk with the client and explore what the cause of that moral issue or moral incongruence is. And based on that, we can come up with a solution.
Thank you. We have a question here in the chat. Our local free addictions counseling organizations will not support students for PPU. Any specific recommendations for free supports for treating PPU in students, perhaps among the resources on one of the last slides?
Emily, do you want to
Well,
take this over?
Yeah, what I could say is, well, this hands-off CBT intervention could be something they could look at online. It's really too bad that they won't support students for PPU. But yeah, on that slide, I've put a couple of many resources, like addiction centers. There's also the 12 steps groups that can be helpful. They welcome anyone. So and not all of them are based on kind of faith or spirituality. Some of them are agnostic groups. So these can be good options for people to meet like a community of people who have the same kind of problems and just talk about it. But yeah, on that slide, you can look at different websites of centers for addiction, including PPU. Others are just psychotherapists that treat PPU, so or sexologists as well. So there's a few options on that slide that you could look at.
Thanks so much, Emily. I just want to remind folks that we at CICMH also have a little info sheet on problematic porn use that's specifically for students. So if you want to check that out and have that printed and available, you can do that. We also have more time for questions. I know there's one here that's again on ethical porn use. So does the studies address ethical porn use and its effects? I was thinking that people engaging in ethical porn would have less moral issues.
Unfortunately, we don't really have scientific studies on ethical porn, but for example, based on interviews with participants, we can see that especially for women, when they watch porn, ethical porn with their partner, they report better sexual satisfaction, better sexual functioning, and less sexual distress. So we can see this kind of data.
Okay. And then I think I'm going to ask one more question and then we'll wrap up. There's a question saying substance use during teenage years has a greater impact on sensitization of brain reward pathways. Are there any studies looking at this with porn, other outcomes, and comorbidity with other addictions greater for those who develop PPU during teenage years as opposed to adulthood?
Yes. So yes and no. The response is yes and no, because we have some studies, but mostly with adults, especially men, who report when they started to watch porn and how they started to watch porn when they were teens. So yes and no, we don't have studies that follow teenagers for a long time. And what I would say is that we can see that people who started to watch porn from a younger age are more likely to develop problems with their porn use over time. This association between age at first use and PPU is not strong, so I wouldn't say that everyone who started to watch porn from a young age will develop problems with their porn use, but they have a bigger chance to develop problems with their porn use. And regarding the brain and sensitization, we can see that exposure to porn can be similar to gambling. This is what studies on the brain show. So yes, that's what I say. We don't have many studies, but the studies we have suggest that it can be more harmful when teenagers start to watch porn from a younger age.
I know I said final question, but one more question from my end. Can you speak a little bit more on sort of like the impact on relationships with porn?
Yes, for sure. So we have many studies on the impact of the impact of porn on relationships, and some studies suggest that most people say that porn doesn't have any impact on my romantic relationship. That's like 60% of the people, or even more, sometimes 80% of the people. Others say that porn had a negative effect on my relationship, especially those people say this who live with a partner who has different moral values concerning porn use. So for example, when one partner thinks it's totally acceptable to watch porn when I'm in a romantic relationship, but the other says that maybe that's not okay. I feel that watching porn when I'm in a relationship is like cheating. So when we can see these kind of discrepancies, we can see that porn usually has a negative effect on romantic relationships. In other cases, when people report positive effects, that's usually when women watch porn, for example, with their partner, and they can use porn to show what they want to explore or experience with in their sexual activities. So sometimes women or other people as well can use porn to show what they didn't want to say previously to their partners.
Okay, that's very interesting. I think that's it for today, but very, very insightful conversation. Thank you so much, both of you, for this great presentation. I know we're sharing the slides, so if folks want to get in touch, emails are already there. And reminder for folks that we have our post-webinar survey in the chat, but it will also pop up once you end this webinar. I also want to remind folks that you can access our past webinars and the recording for this webinar on our website. If you go to our webinars and podcast section, this is where you will find it. I've put the link for our website in the chat so you can access that. And I'm seeing a lot of thank yous in the chat, so I think a lot of folks enjoyed this webinar. Thank you again for all of you for joining us today. We won't have any webinars for the next 2 months, but our next webinar will be in September, so I hope to see you then. But yeah, I will end this webinar now. Thank you so much.
Thank you. Thank you for having us.
Thank you so much. Bye-bye.